Okay, well, I'll start by acknowledging the Gunai people, traditional owners of the land on which we're meeting today, and paying my respects to elders past and present. I'd like to thank Leanne for the opportunity to come and present today. It's a great day. And as Alice said, my name's Leanne, this is Jack. We're here representing the Gippsland, Tobacco Action and Healthy Lifestyle Team. Yeah. So what we're doing today is we're just going to go through a little bit about what we've been doing and a little bit about what a new phase that we're moving into, and also talk a bit about what you as health workers might like to learn more about, or ways that you can refer clients of yours for extra help. So now I want to make this a real information sharing session, not just us standing up here talking to you, because many of you would know a lot more about this than I do. We're not health workers, we're not doctors, we're not nurses, we're health promoters. So there's a lot of technical information that we sort of have to refer on for advice. So, but that'll become clear. So yeah, this is us. I'll just quickly explain our logo. We had a logo competition last September, October, and we were thrilled to bits to get 27 entries, which was fantastic, and they were all really good quality. This logo that we ended up choosing was by Rob Hudson, and you can't quite read the writing of it, but it says, "Toss the habit, get fit." And the man throwing the spear represents, the sort of strength that you need to quit smoking, and the fact that he's in an active pose across the landscape sort of alludes to the fitness and health aspect of what we do. So we're really grateful for that design from him. And Rob Hudson, yeah, he is, what's his role? He's at the keeping place. Yeah, he's at the keeping place.
Is he related to Alf Hudson? Related to Alf Hudson?
I believe so, they're brothers.
Yeah,
brothers.
Good eyes.
So and the colours that were chosen for that logo were suggested to us by our chair, Daryl Andy, to represent the colours of the sassafras tree, to make it very local and Gippsland specific. So yeah, that's where that comes from. So, thanks, Jack. Okay, so that's that's us. Just a few boring facts. Funded by the Commonwealth Department of Health under the Closing the Gap initiative. So it's a national program. We have a national coordinator, Dr. Tom Kalmer. He devotes about 12 days a year to being a mentor and coordinator for our program, and we are hosted by host organisations around the country. There's about 60 similar programs in the country at the moment, and we, right here in Gippsland, are the most recent program of our type to be established in Victoria, and we began in March of last year. So we've been going for less than a year. And yeah, we're based at Lakes Entrance Aboriginal Health. But we cover the whole of Gippsland. So we don't have the staff to do so due to recruitment freezes and government cuts and all that stuff. But our host organisation is Leigh Harbour. We're expected to cover the whole of Gippsland. We're just going to have to tell the department, be a bit more realistic, but we're doing our best. So, okay. So why have a program like this? It's because tobacco use is still it's a major and I believe still the single biggest preventable contributor to the gap in life expectancy between Aboriginal and Torres Strait Islander people and other Australians. So yeah, to trip over anything. So this graph was given to us by Dr. Kalmer from ABS sources. So this shows for Aboriginal men and Torres Strait Islander men, the life expectancy at that point was 67.2 years, so that's a gap of 11 and a half years, and for women there's a gap of 9.7 years. And I've looked at the data since then, and the gap in life expectancy since these figures were taken in 2005, 2007 has narrowed by less than a year for men and only 0.1 years for women. So there's still a really significant gap. And when you're talking about the contributors to the gap in life expectancy, a lot of that comes from chronic disease, and tobacco is the biggest single cause of or contributor to chronic disease. It's the biggest risk factor, although obesity is getting up there. So programs like Gippsland and Leanne's health promotion programs all have a really big role to play as well. Lack of physical activity, low fruit and vegetable intake, they're all risk factors. And our focus at the moment has been on tobacco for that reason. There's, since people started sort of taking these figures, there's been a really big gap in rates of smoking between Aboriginal and Torres Strait Islander people and the general Australian population. So if you just look at the left, when these were taken, I think this was 2008, it was like 48%, or not actually, no, it would have been about 2002, 48% of Aboriginal people smoked, and just about 20% of the non-Aboriginal people smoked. So you go on to the next one. So since then, and since programs like ours have started, the rate of smoking among Aboriginal people has dropped quite significantly, but there's still a long way to go. So it started off about nearly 50% in 2002, then it dropped to 44.6 in 2008, then 41.6 in 2012. So good headway, we're making good headway. But Aboriginal people and Torres Strait Islander people are still more likely to smoke every day than non-Indigenous people in every age group.
Why is that?
Well, there's a lot of social determinants of smoking, and we'll talk about this a bit later. But if you were to go to a quick skills training, they go through that in a lot of detail, and they talk about they actually talk about the fact that big tobacco targets the poor, the black, the disadvantaged. They target them.
Yeah, can I ask, for the survey that was taken, was that the same people, or was it different communities, different areas every time the survey did? I'm not sure if you know, because I know it was other people that did it. But that top when you're saying the percentage of Aboriginal Torres Strait Islander, did they go to the same people, or was it different communities to get that in each year?
Well, those are national figures from the ABS, so that would be an average across the whole of the country.
Yeah.
But we know that in remote regions it can be much higher. Yeah. So that's an average across the whole country. Yeah. If we go back one.
I just wonder though if we're capturing that, because not a lot of our communities actually fill in those surveys. So if we're actually saying that the percentage has dropped, is that just because we haven't had as many Aboriginal people filling in the ABS surveys, or that's
easily?
It's always a concern with ABS that they're never exact percentages.
Yeah. I'm not sure of the methodology, but these a lot of these figures come from the.
Because I know personally, I don't fill in one of them surveys when it comes to my house.
Yeah.
And I don't know how many other people would actually fill out one of them surveys when it comes to their house in this room.
What about
Australian Euros?
Yeah, that's right.
Do you fill out that form that comes? That's what I mean, they say people never percentage of that, but I just never know whether it's capturing the true numbers when there's not a lot of our communities. Like I know Lake Charles, we don't even get the surveys out there, so no one's going to fill them out, so we can't capture that area.
Yeah.
Do you know what I mean? Like it's hard.
Is that the stats that only the Bureau of Statistics doesn't send a census form out to hectares?
Yeah.
I've never seen one out there, and I've never had anybody, someone would come in and ask me to help fill it out. I've never had one person come in and ask
What
me.
you can do, I've just done that. Like I just, I've got the whole started having a conversation with this lad, who's an Aboriginal man in Australian Bureau of Statistics, an Indigenous Indigenous thing, and then I've just only found the stats, I'm sharing it with you. They can actually go and pull your Indigenous stats from the ABS. But what you're saying is, I know in different areas, they've actually employed Aboriginal people to go and to brewery houses with the big road. Yeah, because I know that local women from Vansdale was doing it around Raymond Island and around Paynesville and Vansdale one time.
That's
So maybe it's good to
consent-based.
have a conversation with them. So well, we have population, this bit of population in East Gippsland or Lakeside. We'd be able to get somebody out just so that you can actually send the stats.
But it's worth for the health workers to know, because in every conference or every forum you go to, they're going to put percentages up there, and the majority of the time they say that ABS. But for me, I don't actually take that into it. Like, they're important figures because they have captured some of it, but it's not the whole.
Yeah.
You're not capturing the whole numbers.
Those who
how
go
many
to
people are
consensus
taking up
survey.
smoking, how many people have quit but then go back onto smoking, like all those little questions.
Good
as well.
point.
So I just thought I'd point out to the health workers that when you are being presented stuff, don't always think that ABS is correct, because ABS can sometimes not have the full information. It's the
So
same
if you-
like any poll, isn't it?
yeah, in Victoria, we were talking about earlier that Aboriginal people don't always claim that they are when they go to see a doctor, so we're not actually capturing proper stats in Victoria, so that's something you can promote in your own communities, so that we can get proper stats, so that we know how many people in Victoria, we know how many people are really quitting smoking and taking up smoking. That's something you need to think about and promote in your community, so we can get exact facts.
The last time that I got one of the smokers' stats done was by your son. He came over home and sat down with me and did all of that with me. Yeah, that was a couple of years back now, I think. Yeah.
It is a real problem. Like, remember, you gave me the details for that quote from the ABS, and we were trying to get Gippsland specific stats from them, but they don't drill down that far.
Yeah.
Even if they had surveyed everyone in Gippsland, they don't separate the stats in that way. We could only get them for Victoria.
But that's something that, we look at a consortium level as well. Those, because you're attached to the ATROs and that, they'll actually put, some of them might go into data or registry or whatnot, and how many people are presenting with, smoking, how many people are, so if we can get that down pat and make sure that the statistics reflect what we're actually doing. So there's a lot of work to do, but if we keep that discussion going, we can make it reflect that better.
And another difficulty is that often people don't record smoking status in programs like medical director and similar programs. So if
So it's really
doctors
at the
and
moment, it'd be really down to the health workers
Yes.
that have, if you're touched on that, if you're interested in that smoking cessation, and actually go out and survey your community yourself.
yeah,
And
we've
then when
actually
they comes in, give them a questionnaire and get the ideas of your community yourself. Might be a good place to start.
we've actually developed a survey from our program, which we tested at the Cape Conran Surf Day. We surveyed 124 people, and that the reason we developed the survey of that particular way was to try to gather stats on how many people smoke, what age group we're looking at, and so forth, and also a bit of information to point us in the right direction as to what programs might help people. So if people think, they want to know more about certain ways to quit, or they've tried certain ways to quit in the past and they have or haven't worked, we've captured that in the survey. So we've brought those with us. So we'll I'd love for everyone here to do one if you didn't do one at the surf day, but we'd also be ecstatic for you to take them back to your own workplace and gather those stats and feed them back to us so we can collate them just for the Gippsland area.
Because we'd love to see our stats and graphs for this area.
Sorry, what was that?
My question was that survey you're talking about, that's online, is it?
No, it's not yet. I've literally just written it, so.
It'd be nice out of your program, Leanne, if we can actually gather that and help you gather so we can get an idea of our region and how people smoke. So that's something that all our folks can look at.
Yeah. So what I might do, at the moment I've developed that survey. It's designed to sort of be done by a person at an event, but I could develop it to make it more online friendly and say, do you live in Gippsland, what area, etc., and add those questions so we You know, so we're not, if it's online, we don't want to capture people who are everywhere, you know, so, yeah, okay, but yeah, we'll do that, that'll be great.
It would be nice for you to come to you and say, oh, can you give us an idea of how many people in our area have quit smoking before? And what things they've tried to quit smoking, you know, and then we can get an idea of that. We can, you know, go with what works better than trying the same thing that doesn't work.
Exactly, yeah. If you, I'll pass it around now actually, so you can just have a look. Bear in mind it's not, you know, it's not perfect. But, just pass that, please, thank you. But it seemed to work all right, you know, when we tested it. We didn't sort of run into any problems. And the way it's written is so that you can actually pull out, it sort of goes in a particular sort of order, so you can actually collate stats on age groups and gender and that. So you can pull out, you know, numbers. So okay, we'll keep going in the meantime. So yeah, the bottom point is that even though smoking rates appear to have come down nationally, smoking rates among non-Aboriginal people have come down at roughly the same rate, so the gap remains. So yeah, we're trying to close that gap. We're trying to really concentrate on, you know, getting Aboriginal and Torres Strait Islander people to not quit smoking or not take it up to address those chronic disease factors. So, okay. So as I said before, our program is a bit different and a bit unusual, you know, compared to a lot of clinical sort of programs. Like, we're not clinicians, we're health promoters, but at the moment there's 4 ways that we've been sort of trying to address this issue. We do health promotion at events, and I'll go through all of these one by one in a minute. One of our big tasks is to produce a locally produced, locally sourced social marketing campaign. We're also tasked with providing some direct assistance to people through programs, brief interventions and referrals to nurses and GPs. And finally, we play a role in capacity building and upskilling of health workers and other people involved in tobacco cessation. So that's us at events. I just put in our half-yearly report, and I was surprised, we actually went to 12 events in the last 6 months doing this sort of thing. So we went to, some of these are earlier in last year. We went to Reconciliation Week event at Lakes Primary School. That was, on the right was the Kids in Motion, one of the Kids in Motion days. We did basketball day and stuff like that, and down on the bottom left was Cape Common, and on the right we also went down to Wilson's Prom. We were invited by a primary school down there to join a group of kids that they'd selected because they'd done really well in school. They'd selected them to take them on a camp. So we went down to the camp and did some activities with them, and just some hands-on stuff. So we had a pretty active game of tobacco catchball. So you know, just getting the message out there. We have little giveaways and stuff, and you can see here, you know, we have put up little displays and things to get people thinking. So and kids like the big cigarette that has the on one side it just looks like a normal cigarette, and on the other side you see all the poisons that are actually in it. So they love that. Okay, and as I said, the biggest task for us over the last 6 months has been getting this social marketing campaign together. It's coming to a conclusion now, but it's been like an 8-month process. We did 4 community meetings that were just introductory meetings to tell people, you know, what we were thinking of doing and get advice on how best to do it. And then we had the first round of 6 community meetings we went through Orbost, Lake Tyers Trust, Lakes Entrance, Beansdale, Sale and Morwell, and talked. I just said to people, you know, what are your thoughts on smoking, and, you know, what have people tried and what's important to people, and just got a whole lot of input as to what people thought an effective social marketing campaign would be like, and including what hasn't worked in the past. So, go back. So we put all the ideas together, and then the producer and director Wayne Tyndall, went away and made up 8 potential storyboards for TV ads, and came back and we did another round of 6 meetings where we presented those 8 storyboards to people and said, pick your 4 favourites that you think would be most effective and we'll film them. So at the end of that second round of 6 meetings in the same locations, 4 ads were chosen to be filmed, and so then we went on to the filming process. And that's little April Mullet at the very end of the filming process going, and cut. So she was gorgeous, and she was a bit of a star in one of them. So we filmed, it was a massive effort. We filmed 67 community members for inclusion in the ads, and so that we're thrilled to bits with that, because there was just really broad community involvement from a number of different places. From many people came from Orbost, they brought their kids, quite a few from the trust, quite a few from Lakes, some from a family from Traralgon, the Murphys. I think they live in Traralgon. So they come from the west. So yeah, we had a very, very intense but great time. So at the moment, that's all been edited. It's being voiced by local people as well. So it's currently being, in production. I've seen the rough cuts that went for 30 seconds, because 30 seconds is a fairly standard ad length. And I saw them and rang up the director and said, Wayne, these are fantastic, but I'm going to drop a bombshell on you. I want you to make them all a minute, so we can fit everyone in. So, because a lot of people had to be cut out from. So he's then gone. He really given me a hard job this close to the launch date. But he's gone away and he's making them a minute, so we can fit many more community members in. So hopefully everyone will be able to see their kids on TV. and yeah, I just wanted to make sure that the really broad community involvement and broad community support reflected in the ads. So that's what's happening at the moment. So yeah, we'll end up with 4 one-minute TV ads, 4 billboards that reflect the images in the ads and the messages in each of the ads, because each of them is different. Similarly, 4 posters with little extra information that people can read while they're standing in front of the poster. USB wristbands with all the electronic stuff on it. T-shirts and caps to support the message. And the launch date will be 27th of March, and the TV ads will go on probably the next day, and they'll run for 3 months. So the launch date, that's going to be a big deal. It's going to be a big party, and I'll explain how we've done it. We've booked a venue, and it's going to be a dinner and a screening and everything. And we've catered for we figured out by the time we had together all the community members who were involved and all the people who came and supported our meetings and gave us, much needed input. By the time we counted all them up, plus a couple of guests each, it came to about 300. So we've produced 300 tickets and distributed them to all the people who either came to a meeting or were directly involved in the ads in some way, and we've given them extra tickets so they can invite people who they want to be there, rather than us deciding who we think should be there. The people who are involved in the ads can bring guests. So yeah, so that'll be the hottest ticket in town, hopefully. So so that's what we've been doing up until this point, and that process is going to sort of come to a conclusion soon, and everything will be out on TV. So then, having hopefully created demand, we're going to have to meet it. So we go next. Okay, so we're now going on to two things. We're thinking about how we can directly assist people who want to quit or want more information about smoking. And we're also thinking, how can we help to assist existing health workers and ACHOs and people who are already working in the field to more effectively respond to people who come to them for help. So these are the things that I'll go through in more detail as specifically. But yeah, like there's a big, even for people who are not clinicians, who can't prescribe things or are not nurses, there's a lot of things you can actually do to help someone who wants to quit. And your toolkit includes these things like the 5 A's, the stages of change model, nicotine test, smokealyzer, techniques for breaking a habit, information about chemical help that you can get, and you can make referrals to a doctor for scripts. So we'll go through those like just one by one quickly. How are we going for time? Thanks. Okay. So the 5 A's, a lot of people who are specialist tobacco cessation workers use these whenever someone comes in the door. So the first one is ask everyone whether they smoke, ask them about their tobacco use, how much they smoke, etc. Advise them to quit, sounds obvious, but remember to advise them to quit smoking.
Encourage.
Yeah, encourage, yeah. It could be an E, but... so assess people's willingness and confidence to quit and assist them in their quit attempt if they're ready to make a quit attempt, and arrange for a referral and or follow-up. Okay, so for each of those, you've got particular items in your toolkit that can help you. So having asked someone about tobacco use and advised them to quit, they might say, I don't want to, So then what do? Like, do you give up? No, you go on to, thanks. So that something like the stages of change model can help you and them understand where they're at. So often this is represented as a circle, but I like this spiral better because it demonstrates that every time you make an attempt, it gets easier. Like you learn more about your own triggers and your own things that work for you and things that don't work for you. So if someone's not ready yet, there's a lot more detail at every stage, but there are certain things you can say and do to assist them, in sort of thinking about the good and bad aspects of their smoking and just planting the seed. If they're preparing for action, there are things that you can do to advise them. If they're already trying to quit, there are other things you can say and do that will encourage them. And if they said, I tried to quit and it didn't work, then you have a different sort of set of things that you can say and do. So it's actually, I've only got one copy of this, but it's actually more like a flow chart. So, if someone gives you a particular response, you can go down this path or this path or this path. So that can be a helpful model because it's not just either or. It's not just like, oh yes, I will quit, or no, I can't. That's a process. Okay. Another thing that we can use is the smokealyzer, which can be a lot of, like kids like it, can be a lot of fun. It's like a breathalyzer, but it measures carbon monoxide levels in your bloodstream.
Do you have one?
Yeah, I do. Yeah, you can have a go on it when we finished, everyone can have a go. Yeah. So it can be really good because often everyone knows that smoking is bad for them. You don't have to tell anybody that. But often people don't, until they actually can see that it's affecting them in their bloodstream right now, that can sometimes be a bit of an eye-opener for them. Particularly when you tell them what it's measuring is carbon monoxide, and that means that there's less oxygen. And that's what gives you the heart disease and, risk of stroke and
lack of oxygen.
Exactly, yeah. So
It's like acidity, isn't it?
Yeah, well, it's not just about.
It's increase the acidity and also increase the lack of oxygen in the body.
Yeah, well, it helps people make the connection because it's easy to make the connection between smoking and lung cancer. It's not always so easy to make the connection between smoking and heart disease, but it helps to explain that. And also, if somebody has quit, they can see the benefits within a couple of days. You know, it can go from the red zone down to amber, down to green. So, and it's also really helpful for people who don't smoke but who are passive smokers. I haven't personally done this, but I've heard of people having their kids put on the smokalizer and registering amber because of passive smoking, and you know, nothing could scare you more. I know. And the model that we have has a setting where if someone is expecting a baby, it can also measure through their own bloodstream and their own breath. It can measure the amount of carbon monoxide that their baby would be experiencing as well. So that can be an eye opener too. So it just gives people a real visual aid, you know, to learn more about the immediate effects of cigarette smoking. Okay, the nicotine dependence test, that's another thing in the toolkit. That's a questionnaire that measures how dependent on nicotine people are and how much or how strong their withdrawal symptoms are likely to be. And that that can be useful for helping someone determine whether something like a nicotine replacement therapy or Champix would be helpful to them. Like if they only smoke 5 a day, but they find it really, really hard not to, then it's probably not because they're addicted to nicotine. Like it's probably more, you know, the routine, habitual aspects of it. So it sort of helps you focus on, you know, what might be most useful for them. You know. Okay, so just a little sidetrack, why is nicotine addictive? Most of you probably know this, being health workers. So it attaches to receptors in your brain, causing release of chemicals, including dopamine and serotonin. Serotonin is my favourite chemical. So you get a chemical reward for smoking. And it actually changes your brain function. You have nicotine receptors in your brain, and when you feed them nicotine, they change their level of sensitivity. So that requires more nicotine to maintain normal levels of dopamine, and that leads to addiction, so that no nicotine, dopamine deficiency equals cravings. So I mean, that's, as a non-health practitioner, that's my understanding. So feel free to jump in if anyone has more information on that.
What are they? Nicotine replacement therapy? That's where they introduce chemicals to the brain to stop the dopamine. Is it dopamine and other chemicals that attach to the receptors of the nicotine receptors in the brain?
There's 2 alternatives, and someone like Carolyn Alchemade, who's not here today, can give you more information about how each of those work and how and whether they can be used together.
What you just described is how Champix works.
Yeah.
Whereas the patches and all the NRTs do give you nicotine,
but not like
instead of having it out of a cigarette.
Yeah. I failed Champix and it's a failure of mine. I'm wondering how many other people have failed. What other options are there if you failed with Champix years ago?
Well, yeah. I would disagree that it's possible to fail Champix. But yeah, so we'll tell you, we'll go through the differences between them, and then we can.
Yeah, it's like you said, though, you've got to want to give up too.
Yes.
Not get something else to give you to stop you. You have to want
psychological.
Yeah, absolutely. Yeah. So if you click on the next one. Okay, 5 minutes. Okay, we'll go really quick.
Sorry.
That's all right. Okay, so NRTs, nicotine replacement therapy, they work by replacing some of the nicotine that you would be getting by smoking to minimise your withdrawal symptoms, reduce cravings, and let you concentrate on the habit and the social aspects, you know, to try and break the habit without worrying about your physical addiction. So yeah, there's a lot we could say about that, but we'll be doing I'm hoping to do a workshop just on, you know, pharmacological therapies at some point soon down the track. Okay. Yeah. So Champix is actually the opposite. Champix is the one that works by blocking the receptors in your brain and making it less pleasurable to smoke, and at the same time it causes your brain to release a smaller amount of dopamine but steadier. But again, it's designed to reduce your withdrawal symptoms so that you can concentrate on the other aspects of your smoking habit. So, okay, and things like this as another item in your toolkit that helps you concentrate on the non-physical addiction parts of smoking. You know, so when you get a craving, the 4 Ds: delay, deep breathe, do something else, and drink water. They can help. You know, there's also relaxation techniques that can help and so forth. So just quickly, so having, you know, that's sort of what we're moving into now, like a bit more direct assistance for people. We also want to do more in terms of capacity building. Last year we hosted a 3-day accredited quick skills training workshop and had a fantastic time. Like, a lot of familiar faces there. So, and that is really good because it's run by Quid SA. It's free, it's accredited, so if you're doing a Cert 3 or Cert 4, it will count towards that. And yeah, they'll come over. They're quite happy to come over, and as long as they can get enough numbers, 10 or 11 people, they'll come over and do it. So, and in fact, there's one coming up in Melbourne. There's a flyer in your bag for upcoming training in Melbourne. If anyone wants to go to that, you know, you just got to get yourself there. So yeah, like I said, this one's coming up, Melbourne 24th and 26th of March. Quid SA, and the flyer for that's in your show bag. And also there's that show's got a best practice 3-day, 1-day workshop, and I've been to one of them, they're fantastic. So Melbourne 15th April, that flyer for that's also in your show bag. And we here at Leanne, Gippsland, are also sort of establishing a tobacco workers network so that we can more easily share information like that. So if you want to join that, just come and see me, and yeah, we'll start getting email information out to people in the network. So, okay, so a lot of information. Sorry, but yeah, thank you for listening.
Does anybody have any questions?